What is a downtime of having a large lipoma removed? Well, it depends what you mean by large. I've just sent out an email to the patients on my database with lipomas saying, hey guys, we can remove large lipomas, with a photo of someone who'd had a large lipoma removed, which was kind of like that big, like tennis ball, I suppose, size, which I thought was big. And then someone's got into contact today with a massive, absolutely massive one, even bigger. So absolutely huge. So and you know, I stand by. The thrust of the email was we can remove lipomas of any size, and we can remove the patient who's got in touch with a larger one, but that would need a general anesthetic. It's intramuscular lipoma, which makes it more difficult. It's kind of around the spine, so it's a difficult one. But we can remove large lipomas, and so the downtime just depends on, like, if it's a really large that needs a general anesthetic, which is very rare. Even big ones, as I say, this one was like the size of a tennis ball. We did it in the clinic under local anesthetic. So the majority are done under local anesthetic. And when it's done under a local anesthetic, that means you kind of walk in and walk out. So you're in the clinic for a couple of hours, but it's like walk in, walk out, go home. You will be uncomfortable, and you will often have a dent to start off with where the lipoma was, and then you can have swelling in the area. So the first week or two, so you'll have a dressing on for a week. So I would say you don't want to get hot and sweaty, certainly that first week, because the dressing's on. So if you get hot and sweaty, it's like a greenhouse, the dressing, because it kind of doesn't breathe. Usually lipomas are, well, not usually, always lipomas are underneath the skin, so you don't have to take any skin out, which is good. So you normally just make an incision in the skin, unless the skin has been stretched a lot by the lipoma, in which case you might take a bit of skin out. But either way, when you're closing the skin, it's not under tension, so it's different in that respect than when you're doing a mole removal or a tattoo removal or some other lesion. That a large skin lesion would mean that the skin would be closed under tension, so you'd have to be very careful, and you'd have to take it a lot more easy than you would if you're having a large subcutaneous lesion removed, like a lipoma or a cyst, because those ones don't take out much skin, so the skin's not under a huge amount of tension. So in that respect, the downtime is a little bit easier, because no skin's removed, but nevertheless you have an incision there, and you will have had surgery, which can make you feel knocked about, battered and bruised. So the first week you don't want to get too hot and sweaty. You can wash and shower with the dressing on. After the first week, so you'll be able to walk around and do stuff. So in terms of downtime, depends what you mean by, like, you know, you won't be down, you won't be in bed, you'll be walking around, and you'll be up and about. And you know, if you're not too sort of manual with your work, you'll be able to go to work, but it will be a bit sore. After the first week, the dressing comes off, and you can wash and shower normally, and then I would say take it easy for another week. I'd say 2 weeks to get that wound knitted together, and then you can start getting back into things, gently getting back into things, exercise and what have you, depending on how it's all healed. Hopefully it's all healed beautifully by that stage. Sometimes not. Sometimes a little bits of wound that hasn't healed up properly, in which case we say, look, take it a bit easier, because you've got a bit of wound there that's not quite right, or there's a bit of a dissolvable stitch there that's, you know, gone a bit red, so take it easy. So it does vary on a case-by-case basis, but that's kind of generally the general gist of things.